Hi, my name's Brooke. I'm one of the nurses at Teaching Valley Veterinary Hospital, and today I'm going to be running through some rehabilitation for a post-operative TTA or a cruciate repair. This is Sheldon. He had a TTA done 3 weeks ago, and so we're just going to run through the first 3 weeks of rehab that you guys can perform at home to be able to help your dog along their way in their recovery. Alright, to start with, we're going to ice our dog's leg 3 times a day. We want to be icing it for approximately about 15 minutes. It's really important that if your dog is feeling uncomfortable or he or she isn't liking what you're doing, to stop. We're going to start off by just grabbing a cold compress. So it's just like a little ice pack, you can get it from your pharmacy. Popping a towel around it so it's not directly on your dog's skin, so a little tea towel or even like a Chuck's wipe will be fine. So I'm just going to place it around Sheldon's leg. So it's just around the area that he's had his surgery, and we're just going to keep it on for about 15 minutes or sort of as long as the dog will tolerate. It's important that you don't put the ice pack straight against the skin, so it needs to have a barrier in between. So the next exercise we're going to do is called passive range of motion. So we want to start off, you can either lay your dog on its side with the leg that's had the surgery on up, or you can have him standing up. Sheldon likes to be standing. He doesn't really like laying on his side. So I'm going to, first thing we're going to do is support under his abdomen, and then we're going to gently move his leg so that it's off the floor. And we're going to support his leg the whole time, as well as his weight. So if he's not feeling comfortable on his leg, we want to make sure that his weight is on us. So we're going to start off by performing range of motion with his ankles here. So we're just slowly and gently moving his leg. And you want to be doing this sort of around 10 times and 3 lots of 10 repetitions if you can, if the dog will tolerate it. So the next exercise we're going to be doing is passive range of motion with his knee. So we want to be supporting his weight. He can once again either be laying down or standing up. So we're gently going to lift his leg off the floor, and we're going to bend his knee and back down again, and gently just bending his knee up and down. And you want to be doing this probably around 10 times for 3 sets. So the next exercise we're going to be doing is a range of motion with his hip. So it's really important not to stretch his leg out. We're just trying to allow him to rotate it around. So we are going to, once again, supporting his weight with our arm either under the stomach or having him laying down. Gently lift his leg up, and we're going to be rotating his hip around. Once again, doing this until your dog, if they're feeling uncomfortable, you need to stop. Otherwise, 10 repetitions, 3 sets. Next exercise we're performing on Sheldon today, and this is the last one. We're going to do joint compressions. So these are generally around 2 to 3 seconds. So you're wanting to support the joint with both hands. So we are having one hand just here and one hand below the knee, and we're gently compressing the joint, as I said, for 2 to 3 seconds. So it's not actually looking like we're doing much at all. It's a very gentle and subtle movement. So those are the exercises for the first 1 to 3 weeks. Tune in for the next video to see the next stage of rehabilitation, and hopefully this has helped. Please please make sure that if you have any questions, do give us a call. Otherwise, you can book in with one of our consult nurses to show you the exercises and the rehabilitation. Thanks.